Here I'm going to ask Dr. Tovah Goldfine a question that many of you are curious about regarding repressed emotions, because many of you are recognizing the importance of discovering those emotions, but you might be having trouble with that. Dr. Goldfine is a doctor of chiropractic out of Israel, and she has decades of experience utilizing TMS psychophysiologic approaches to healing and working with her patients. So I'm excited to ask her this question. I'm not aware of any repressed emotions causing my sexual dysfunction. How do I discover if this is a potential cause?
Shalom, my name is Dr. Tovah Goldfine. First, let me preface something about a question. All questions are good questions, and there's never a right and wrong answer when it comes to the mind and body. The mind and body are intimately connected, and it's such a gray area. So what works for one may not work for another. But in general, we can give answers to questions and then individually help you learn to apply and integrate it in your own life with your own process, in your own experience. And this is what makes it so individual and so powerful. And so many are healing, and you can heal too. So this question, I'm not aware of repressed emotions causing my sexual dysfunction. How can I discover if this is a cause? I'm going to give you a few different possible answers. So first of all, it's very important to understand that every symptom, especially chronic autoimmune, chronic pain, there's an emotional cause. For many of us, it's just psychological. If you haven't been able to get help from the medical doctor or the medication or through surgery, it's chronic, it's medically unexplained, and it becomes neuroplastic. And there's a psychological cause to your physical manifestation of symptoms. So we go right to what's happening psychologically. The brain does not differentiate between a psychological threat or a physical threat. So if something is threatening you psychologically, your body will react in the same way as if something was affecting you physically. So let's talk about the unconscious mind. 95% of our thoughts are unconscious. So the job of myself and your therapist are to help you connect your conscious mind to your unconscious mind. And this is the healing. If you can know what's going on unconsciously, then you will know that you'll become more aware of your repressed emotions. Now, we're all repressing emotions, and it's okay. We can do that and not be in pain. I can feel anxious and worry and not have physical symptoms because I'm aware and mindful that I'm having some anxiety. And this is the healing. This is the healing journey. But if we're unaware, then part of the job is to understand how we're wired. How do I react to fear? How do I deal with my anger? How do I deal with my sadness? And you know what? To not know what you're feeling, it's okay too. It's not a judgment. We're not criticizing. We're saying it's part of the healing, working the new muscle to be able to have a healthy relationship with your emotions, to be able to witness and observe and recognize what you're feeling. I'm going to take a little different angle. Some of the research is that when I'm having an anxious thought, a worried thought, it will create an inflammatory response, and my body will start to react with inflammation. Now, there's lots of things happening in between that, but bottom line is the research is saying when I am feeling anxious, I'm having anxious symptoms, I'm worried, I'm scared, I could be fine out here, but in my unconscious mind, this is what I'm feeling. The brain will protect us. Again, the body's not punishing us. The body and brain are protecting us, which is kind of a paradox. And inflammation will happen. It will be the reaction of the body perceiving a threat. It's a journey. And there are many ways to go deeper. It's also about knowing yourself. And if you're not aware of repressed emotions, then it's okay. But you are having emotions because you're human. So the answer is to find ways to go deeper, because there is a major percentage of your emotions that are causing your symptoms. From where I come from, any chronic pain or autoimmune symptoms are being caused by psychological conflict. You know, I'm going to speak this one more possible answer. When your body is having physical symptoms that are chronic, there's a conflict deep inside. And that's coming from your unconscious mind. And to develop a healthy relationship between your unconscious mind and your conscious mind is this process. And when you do that, the body will have no reason to have physical symptoms. Your body will be in harmony. Your body will be in homeostasis. So I hope I've answered this question. I'm happy to come back and answer it again. All the best and blessings.